All right, let's reconvene. People from the breakfast area. um, Congratulations on making the time change work for you. It's not working for me too well. I'm using color to wake up. So, how many of you are here for this day only? We're not here. Okay, quite a few. Welcome. The witnesses of yesterday. Did you feel like we've built up energy and the Eagle Woman and those of you who went to the concert, that just went off the charts to another dimension. But we'll try to recreate. Yuan Miao is coming here in person, which is a great, great blessing. I did not expect her to come, but she will bring that energy for today as well. So you'll be exposed to this. To introduce myself again to those of you who are not here, I am Helen Lavretsky, and I'm a geriatric psychiatrist, integrative psychiatrist here. I study mind-body approaches to treatment and prevention of geriatric depression and cognitive decline. And since my childhood, I've been super interested in death and dying. I don't know why. It's just karma. So, and how to do it well. So now I'm really preparing and getting the techniques down, how to do it really well. And so yesterday we reviewed some of the things that there are in the psyche of baby boomers who are shaping up how things are done in conscious death and dying nowadays. And we'll continue with that exploration today. It felt like a 2-day-long meditation on death and dying. This is my disclosure slide. I'm funded. Actually, there's an NIH agency that funds this kind of thing. So for years, when I started doing this sort of research about 12 years ago, and at that time I was considered super weird. And now I'm funded to be weird. So I have a career award from the National Center of Complementary and Integrative Health and a grant that explores the role of Tai Chi in coping with depression in geriatric adults. And my yoga studies are funded by the Alzheimer's Research and Prevention Foundation. So I also published a book on resilience and aging, and I'll just go through some of the concepts. Resilience is a dynamic characteristic of the interaction between individuals and their environments, ability to recover from adversity, trauma, stress, and depression. And so the question for me was, does it require a major traumatic event to manifest, to probe this resilience? What about surviving day to day? And in the elderly, it's really surviving day to day that taps into their ability to cope with these difficulties, how to get medications, how to multitask. It becomes more difficult as we age. This construct, of course, can be also fostered in younger adults and older adults, leading to more effective and positive coping, turning adversity into the opportunity for growth. And so my journey is to try to develop interventions that enhance resilience using integrative medicine approaches. And consequently, it should lead to better outcomes for medical and mental disorders of aging. So most of this, how this all lands, so I study mostly Eastern techniques like yoga or meditation that existed for thousands of years, and how they fit in the Western society. It has to do with stress reduction. So yoga in the Eastern religions or techniques like yoga usually fulfilled the purpose of enlightenment. The enlightenment has now gone out of the window in the Western world, and especially with yoga boot camps. And we're more preoccupied about how to deal with stress and how to enhance our health and our longevity. So all of us evolutionally built to deal with stress, acute and chronic, and we're all exposed to stressful events throughout our lives. In the elderly, it's a cumulative effect of experiencing multiple stressors and traumas throughout their lives. And we perceive stress differently, and it's amazingly different. You know, in people with the same stage of the disease, same severity, same pain source, the perception of it is completely different from one individual to another. And it is shaped by some genetic predisposition and developmental experiences, but also personal behaviors like choices of diet, smoking, drinking, exercise that lead to physiological stress response. And usually, you know, if it's balanced and adaptive, it leads to rebalancing of the body and the body responses to stress. Allostasis refers to this process of rebalancing in the face of adversity of stress and adaptation, but if it becomes too much or too chronic, we break up into allostatic load, which is a physiological response to pathological response to the chronic stress. And multiple systems of the body react to stress. They collaborate on stress response. And those are neuroendocrine, central nervous system, peripheral nervous system, autonomic nervous system, and immune systems. They all work together, and they throw their arms when it's too much stress, and so there's an inflammation going on and adrenal fatigue. You might have heard the term, and every system goes into the alarm to rebalance the body, to allow the body to adjust through this. So the theoretical model of resilience is based on this exposure, universal exposure to stressors, adversity, and trauma, and then having individual resources by which we differ, how self-esteem, optimism, coping, social support, personality and appraisal, spirituality, and genetic influences that would allow this rebalancing to occur, and then the disruption that happens, psychological distress, physiological responses, and some of the allostatic load, cortisol level go up, or hypothalamic pituitary adrenal axis gets out of whack, catecholamine levels go up, inflammation, pro-inflammatory cytokines, NF-kappa B, and C-reactive protein. Cholesterol goes up. It's actually a part of chronic stress reaction. DHA's level go down, and that's a protective substance in the body. Diabetes could be a part of this chain. Hemoglobin A1C is a measure of glucose control in the body. Telomerase and telomere lengths we're measuring in our studies, and that's a cellular biomarker of cellular aging. So the lengths of the telomeres and the levels of telomerase tell us our biological age, not chronological, but biological age. And then my favorite, of course, I'm a neuroscientist and a psychiatrist, brain reaction to all of it, and the brain structures that are responsible for stress response are amygdala, anterior cingulate, hippocampus. We measure it on multimodal MRI, and emotional processing. On a task, when people get scared or emotional, we see how the brain reacts to that. And then I've been playing very successfully, it discovers a whole new function of the body, is how gene expression changes with our life choices, lifestyle choices, like in my case with meditation, with Tai Chi, or medication use. So it's a whole new story that is being developed. What happens, and by changing gene expression, it also changes body physiology. And believe it or not, you could suppress, let's say, inflammation and improve your immunity with what you do, what you choose to do throughout your day. So the outcomes of all of this could be a resilient reintegration at a higher level of adaptation. And that's, after really traumatic experiences, people become champions of a cause. So they take on the cause that caused their, let's say, parents of children who died. They would establish foundations and they would fight for the cause. They are champions, so that's reintegration at a much higher level from traumatic experience. From the baseline. Reintegration back to the baseline, which is homeostasis, and so that's something we aspire after an illness. We'd like to reconstitute to the previous level of functioning. But sometimes, and especially with aging, these processes are not as effective as in younger adults or even children, and so dysfunction occurs with reintegration at the lower level of functioning, development of illness, disability, and mortality. So the interventions that we develop look at remodeling, changing this stress response. Let's say conditioning, biofeedback, or meditation works at the level of the brain, and then it also affects all other systems like immune system and endocrine system. And using psychoactive anti-inflammatory agents would do the same thing, using acupuncture, vagus nerve stimulator, and would intervene at some level of this stress response, affecting brain autonomic system immune pathways. So in the book, Resilience in Aging, I actually have a chapter on is there a good death? And Dr. Bayek yesterday said that he didn't like the good death, I don't know why, but he didn't quite explain it, but he likes dying well. Whatever it is, it has the same concept, how to end it well on a high note, literally high note. End-of-life care is a profound psychosocial and spiritual crisis that can manifest as depression, anxiety, and hopelessness in patients and families. Problem-focused approach of Western medicine addresses pain, sometimes spiritual needs, but the individual dignity and spiritual preferences really is not a focus of healthcare, may not be recognized. Dying process is the final opportunity for healing and spiritual growth. Forgive yourself, forgive others. Find love in your heart for yourself and your loved ones. Ultimate communion with the divine, coming into oneness, preparing for the last adventure. Gratitude for the experience of life and lessons learned, and then letting go. Completed journey on earth, so the sense of completion, nothing else left to accomplish, readiness to go home. That's sort of the gestalt of the place to be during the time of passing, if I can. And in Buddhist tradition, that's the teachers typically get there and they teach by going through this. They teach, usually gather students around, they teach their students how it should be done. How to boost resilience. There's a literal stress reduction or hardiness training or optimism training. So they train people. It's sort of like cognitive behavioral therapy to change their attitudes. Basically, whatever you think, you feel is your belief. So you could change your belief by retraining your mind to think differently. For example, glass is always half full, not half empty. And not everybody can get there, but try. There are techniques that have been developed how to change this, thinking about it. Attitude of gratitude, count your blessings daily. Develop interventions that enhance resilience using integrative medicine approaches. It's not easy to change because we're animals of habit, and that drives our lives. Have you ever tried to diet? Is that easy? No. To change the habit takes an effort, but at least you could do it. There are techniques developed around sleep, how to enhance sleep, exercise, limit alcohol and drug use, stress management with meditation, yoga, Tai Chi, diet, nutrition, and microbiome now, and preventive health care. So, as I mentioned, there are a variety of cognitive behavioral approaches like well-being therapy, learned optimism training, hardiness training, all of which focus on positive aspects of difficult experiences, thereby promoting more positive perception of challenges. So you need to love your lesson. You hug your challenge. You embrace your difficulties, relationships. You bless your enemies. Lifestyle factors such as diet, exercise, spirituality can enhance resilience by creating physical and mental well-being. And then complementary and integrative medicine is a holistic and integrative approach to wellness that encompasses varied approaches to wellness, stress and stress reduction, and a variety of this. And I mentioned actual meditations that you could practice for as long as you live, as a child, and then young adult is encouraged in the Kundalini Yoga tradition, many other traditions. You just meditate on this or do this practice so that when the time comes, you just go into this place and you're no longer anxious, you know exactly what to do. Crossing the hour of death is the name of this meditation. So let me just take as I said, you could do this mind-body approaches, dietary, physical activity, body-based, natural products, and then the idea about it, you would affect biology of aging, which is genomic instability. That's what happens. That's why we age and die eventually. Genomic instability, epigenetic alterations, telomere lengths, loss of proteostasis, chronic inflammation, cellular senescence, which is aging, and mitochondrial dysfunction. That's what leads to the demise of the body eventually. And all of these techniques can alter them. A lot of the processes are reversible, and the body is really a resilient machine that can live actually forever if we stop doing harm to the body. So, effects of mindful practices that help achieving mental and physical health, stress reduction, treatment and prevention of depression, and especially in high-risk population, like stress caregivers, older adults with chronic medical illnesses, victims of psychological and physical violence, direct neuroplastic effects on the brain across lifespan, shifts in consciousness, conscious awareness of the reality, cultivation of well-being and gratitude. So this is in your handouts, but I can go through this. This is the research, the areas of research that have quite a bit of evidence for effect for selected disorders. For example, animal-assisted therapy or pet therapy facilitates social interactions, has been studied, and the mechanisms increases endorphins, happy hormones in the brain, oxytocin, prolactin, dopamine, all substances in the brain, and a decreased cortisol, which is a stress hormone. And so it's done one visit in three weekly sessions for long-term exposure. Use aquarium, for example. And we used to have a geriatric psychiatry unit where patients were lined up during quiet hour after lunch and watched just aquarium, you know. So they were 20 of them in front of the aquarium. Music therapy and social interaction also has quite a bit of interest, and National Center for Complementary and Integrative Health just published a public program announcement for funding to study music and brain interactions, what happens in the brain during listening to the music. Movement therapy certainly has been studied, and effects on mood, concentration, and sleep. Light therapy with melatonin has evidence for sleep disorders. Acupuncture for cognition and mood, and aromatherapy, lavender, hops, melissa, essential oils has been studied mostly actually in nursing homes, and also has some evidence for effect for agitation, for insomnia mostly, and anxiety. There are suggestions for older adults and how much exercise one must take to stay healthy, and it's 150 minutes in a week 10 minutes at a time, has to be sustained. You can't do 5 and benefit from it. So you have to do 10 at a time and then stop, and then 10 and 10 throughout the day. So I study mind-body exercise, mindful exercise, yoga, qigong, and tai chi are in these categories increasingly utilized for improving psychological well-being, hypertension, cardiovascular disease, insulin resistance, depression, and anxiety. And that is a physical exercise executed with profound inwardly directed contemplative focus of awareness. Key elements is non-competitive. So boot camp is an oxymoron. Yoga boot camp, not judgmental. You're not competing with anybody. It's your path. Mental focus on muscular movement and movement awareness combined with the low to moderate level of muscular activity, centered breathing, conscious breath, focus on alignment, spine, trunk, and pelvis, and proper physical form. And then there's a concept that is non-existent in Western medicine, and yet all of the Eastern approaches are focused exactly on that, and that's Qi, or life force, or Kundalini, and Prana. All these terms refer to the same universal energy that flows through all of us. Mind-body medicine includes approaches like yoga, guided imagery, meditation, hypnotherapy, spirituality, tai chi, art, dance, and music therapies, or expressive art therapies. And there was a recent National Health interview survey, and that demonstrated a much increased, so it's like 10% increase from 2012 even to 2017. So this is a cultural shift. So from 4% to 14%. And the use of meditation and yoga has really increased. In 2012, chiropractic care was as popular as yoga, followed by meditation. However, popularity of meditation now surpassed it. The use of chiropractors increased from 9% to 10% in 2017. In 2017, women were more than twice as likely to use yoga compared to men, and more likely to use meditation and see a chiropractor. And it's a common trend for all of the years of observation. Non-Hispanic white adults were more likely to use yoga, meditation, than chiropractors compared to Hispanic and non-Hispanic black adults. And the use of yoga was highest among adults aged 18 to 44 compared to older adults. And the use of chiropractic care and meditation was highest in the ages 45 to 64 compared to younger or older group. So those of us who teach this and participate, I'm, as I disclosed yesterday, certified yoga teacher, Kundalini yoga teacher, and I've seen this, especially in Los Angeles, explosion of interest in yoga training and openness to mind-body, even in my own institution. Again, I started doing this kind of work 12 years ago. I could not talk to anybody about it. It was like, close it, go to that corner and do it quietly. Don't talk to us. Now everybody craves it. What's happening on campus? We have, the other day I was like flabbergasted. It was just too much even for me. They played opera on a medical plaza, you know, like for about 20 minutes, loud opera. You know, I've seen things around here, but this is new. Okay, so this is like, we're gonna make you well. Listen to the opera. Whether you like it or not, right? So this is Tai Chi practice. Okay, so something happened to the advance. Okay, so can we get some assistance over here? All right, so I'll talk about Tai Chi Qigong. So although it's less popular than yoga, it's still quite popular, and awareness about it is rising. It is a low-impact traditional Chinese exercise, about 2.5 million and 5,000 Qigong users in the United States. Low-impact traditional Chinese exercise has been studied quite a bit in aging, and mostly for arthritis and agility and stability, risk for falls studies, improves health-related quality of life and physical and mental condition, may be effective in reducing depressive symptoms, stress, anxiety, and mood. In Parkinson's disease, traumatic brain injury, sleep disturbance, substance abuse, and impaired cognitive function. So the problem with studying these techniques, they are multifaceted. And so it's hard to tease out which element, if you care to know, which element produces what effect. And so the elements are, it changes or improves musculoskeletal strength, flexibility and efficiency, breathing, concentration, attention, mindfulness. You imagine flow of light, or you imagine, so you use visualization, physical touch, massage, you massage your body especially, psychosocial interaction usually done in a group or with the teacher, alternative health paradigms, philosophy and spirituality are parts of this, so you subscribe not just to a certain movement, but also to philosophy behind it. And in case of Tai Chi, it's a Chinese teachings, different versions of Tai Chi exist, and they have different teachers, originators. So you also subscribe to the teacher. Ritual icon or a teacher. And environmental effects, you share the same community, same food, same traditions, same choices in lifestyle. So how does it work? It promotes relaxation, decreases sympathetic output, reduces clinical somatic symptoms, benefits anxiety, depression, blood pressure, recovery from immune-mediated diseases, reduces levels of inflammatory markers like C-reactive protein, improves immune vaccine response, and reduces stress hormones, increases oxygenation of the brain and the body, increases blood levels of endorphins, baroreflex sensitivity, and then EEG and more recently fMRI studies have been noting changes in cortical activity in the brain, suggesting increased relaxation and attentiveness. Studies in older adults have been done in depression, stress, anxiety, mood and psychological well-being, self-esteem, Parkinson's disease, sleep disturbances, substance abuse and cognition. I mean, all of the studies have mostly positive results. One study has negative findings on anxiety and very few side effects. You can injure yourself while exercising. And, so I am monitored every year for my Tai Chi study here, and they tell me, so they come in, the person comes in and says, where are your side effects? And I'm like, we don't have side effects, it's Tai Chi. She says, no, you have to report the side effects, we need to see side effects. So we're now looking, one person broke her ankle outside of the study. I mean, she just was on the street, so we finally reported the side effect. What is yoga? System of ancient philosophy, practices, lifestyle, breath control or pranayama, specific body postures, asanas and mudras, and meditation. Worldwide use, really worldwide now, use for health and stress reduction. Prevalence of yoga, as I said, is now quite significant in the US, with 10% increase in the last 5 years. And if you look at the age distribution of use, it's not much different from each other. So even older adults could participate. There are variation, adaptation of yoga, different yoga practices. There's silver yoga, yin yoga, restorative yoga that don't require as much agility and can be used in older adults with limitations. And most frequently reported reasons for practicing yoga for general wellness, well-being, improve energy, improve immune function, athletic and sports performance, memory, concentration. And then most frequently reported outcomes, reduced stress level, improved overall health and feeling better, better sleep, increased sense of control, easier to cope with health problems, improved relationships with others, and school performance. A fellow of mine, at the time she was my postdoc, Bianca Acevedo and myself wrote this paper where we compared brain signatures, changes in the brain in mindfulness versus yoga-based practices. And the unique recruitment for mindfulness practices in brain regions was in the brain regions that regulate body awareness and higher cognitive functions. While yoga-based practices or mindful physical exercise also affected areas that have to do with social processes such as speech, language, empathy, and facial processing and self-regulation, can be used for stress reduction and brain fitness. And so in my studies, we also demonstrated that as you do it every day or every week, brain changes. So it can be used as a brain enhancing or cognitive enhancing exercise, although it's a physical exercise. Biological mechanisms of yoga. Chris Streeter and colleagues pointed out that yoga alleviates stress by counteracting imbalances of the autonomic nervous system with increasing parasympathetic nervous system, which is a relaxation system responsible for relaxation in the body, and a decreasing sympathetic nervous system activity. And it also increases GABA, which is a chemical in the brain, also associated with relaxation. And it's like brake substance of the brake, you're pushing on the brakes. In the thalamus, which correlated with improved mood in depressed individuals. A review of 81 studies found that yoga surpasses other exercise regimen in numerous outcome measures of health, such as salivary, cortisol, blood glucose, fatigue, pain, and sleep in both healthy and clinical samples. And in one study of yoga, increased dopamine, which is a hormone of resilience or motivation with yoga in ventral striatum, and it's a major area of brain reward system. So yoga studies in aging have been done in hypertension, again in medical, in the medical field more so than in mental health. Osteoporosis, stroke, dementia, diabetes, osteoarthritis, and healthy aging. Now, neuroscientists got really, really interested in using mindfulness or mindfulness meditation, yoga practices, and to a lesser degree Tai Chi, but it's all becoming one big field, looking at whether we could delay progression to dementia or cognitive decline in older adults. And that's the kind of studies I'm running as well. So this is a meta-analysis of yoga in older adults. Only 18 eligible studies from 1950 were yielded from the review. And because most of the studies were very small in number and had a variety of yoga practices used, and also older techniques were not up to date with research methodology. So the majority of the studies had less than 35 participants, but the review of this demonstrated that yoga makes it that of conventional exercise for self-rated health status, aerobic fitness, and strengths. The side effects, it's a small difference, but it's still significant for yoga effect on depression, sleep, and bone mineral density. In this review of 2012, this was before the field shifted, did not find the effects on cognition. So now more and more studies are being done, especially for cognitive decline. And National Institute on Aging and Complementary and Integrative Health, both are sponsoring this kind of studies, especially with enhanced focus on Alzheimer's disease and prevention. And this is like a big investment, $1 billion is now invested in this kind of research. Another meta-analysis of a large number of studies demonstrated that mindfulness meditation programs had moderate evidence of improved anxiety, depression, and pain, and low evidence of improved stress, distress, and mental health-related quality of life, positive mood, attention, substance use, eating habits, sleep, and weight. So, you know, those of you who are clinicians and deal with patients who are open to it, that's a great adjunct to, especially in those who believe in it and are willing to try it. So let me just show you on the brain scan. So in the PFC, in purple, PFC, let me just see if I can use here. So this is PFC, prefrontal cortex, anterior cingulate, posterior cingulate. And these areas are involved in regulation of cognitive processing, executive control, attention, mood regulation, and memory. Insula over here is a sensory awareness of what's happening in your body. If you close your eyes and just pay attention to the breath and airflow through the nostrils and through your lungs, that would activate insula. And amygdala is responsible for emotional processing of fear and anxiety, and striatum over here in green, reward learning and motivation. So in our comparison, we found that yoga was activating many more areas than just mindfulness meditation, and that was in the areas that are relevant for judgment, discernment, memory, language, visual, spatial, and somatosensory integration, and social cognition and behavior. Can be used in enhancing judgment, self-control, on deliberate actions. Can be used in the criminal system, at-risk youth, substance abuse, mood disorders, neurological illness, dementia, cognitive decline, caregiver, stress. If you think about the difference between how you do mindfulness meditation and how you do yoga, you sit and empty your mind mostly, or you focus on something in mindfulness meditation. So movement is not much involved here. In yoga, you move, you're in a group, you breathe, you chant, depending on the type of yoga. So it activates many more areas of the brain, and therefore many more areas of the brain see the change over time. So this is the complementary study of Tai Chi in older depressed adults. 112 older adults with major depression took citalopram, which is an antidepressant, for the first 6 weeks, and those who didn't respond to that then were randomized to receive Tai Chi versus health education for 2 hours per week, and same duration for a health education program. The reason we take a health education as a control is to control for the group effects. Several people gathered to do Tai Chi or health education, and that also controls for attention effect. We are paying attention to them, and so we could subtract all of it from the pure Tai Chi effect on the body and health. And so we measured, so Tai Chi group demonstrated significantly greater improvement in resilience, energy, and psychomotor retardation, physical functioning, cognitive measures of executive cognitive function, attention, and memory. So that's how it looks. Many more responders in Tai Chi versus health education. Almost 95% responded to Tai Chi, and not so bad in health education. As I said, it was it's very similar in terms of gathering and doing things together. And in isolated older adults, depressed adults, that's quite a powerful intervention actually, because they are mostly at home or seeing doctors. So coming for a engaging conversation to UCLA was a significant improvement on their part, or what they thought about it. That's how it looked over time. Decrease in Tai Chi in the red was more significant in terms of severity of depression on the Hamilton Depression Rating Scale. And this is a physical functioning, goes up with Tai Chi and goes down with health education over time, 16-week intervention. And this is a verbal memory test, goes up and improves with Tai Chi and decreases with health education. And the C-reactive protein also gone down so that's a good thing. And Tai Chi didn't change in health education over time. So this was one of the first studies that I did, and not everybody loved Tai Chi, of course. And the study was performed in 2008-11 through 11. And if you remember, this was a financial dip period. So I had all participants in the study were depressed real estate agents. And they were forced to be in the study because they lost their insurances. They were early 60s, so they couldn't find a job. It was really devastating. They didn't love Tai Chi, which was actually a good thing, because you could discern better. So what believing in the intervention does, it increases placebo response or intended response. If you're the patient, you don't care what helps you. But for a researcher, it does make a difference. Is it a placebo response or is it a real response due to intervention? So at that time, I was still playing with this, not convinced, just investigating. The complementary use of mind-body exercise combined with antidepressants may provide additional improvement in clinical outcomes, like resilience, quality of life, cognitive function, and putative mechanisms via stress response. So then we did the yogic meditation. That was like an unbelievable study to do. Yogic meditation to reduce stress in family dementia caregivers. We used Kirtan Kriya, which is only 12 minutes long. And that was a selling point for caregivers who are very, very busy, and they don't go to yoga studios because they have to take care usually of their children, of their parents, of their husbands. And they have 2 jobs, and they are in traffic in Los Angeles. So no way they're going to make it to the yoga studio. So we just train them to do 12-minute meditation. For many of them who were dementia caregivers, one of the things that happens with taking care of somebody who's dementia, the patient with dementia doesn't let you out of their sight. So they follow you around. You don't have privacy at all. And so some of them had to close themselves in the bathroom to do this, just to have some 12 minutes a day privacy. And so 39 stress caregivers with my son, they were distressed. They were not severely depressed. The new concept for them, this was just a big revelation. I have 20 minutes to myself a day. And so they were asked to do this breathing and chanting. And we measured distress, depressive symptoms, anxiety, burden, cytokines, cortisol, catecholamines, cognition, PET scan, fMRI, NF-kappa B, telomerase, and gene expression. And this is the Kirtan Kriya, which is Satanama meditation. After we did the study and published it, it became like spread like fire. All the people who do yoga with older adults now know about Satanama meditation. They may not know everything about it, but they know how it goes. And it's a chant, Kirtan. The words mean, or sounds mean, birth, life, death, rebirth. Kriya refers to a specific set of movements or chants. And there's an inflection in the voice, Satanama, Satanama. We ask them at the same time, focus their attention on the brow point between the eyebrows, and see the light, imagine the light, white light, coming through the top of their head, going through the middle of the brain and coming at the brow point. We call it L shape. So they're very busy chanting, focusing here, imagining light, and tapping each finger. And so this is a multitasking for 12 minutes a day of pleasant activities, trying to relax. What happens with this practice is meditation improves significantly more than relaxation, so the control group was asked to go to a quiet place and listen to the music, close their eyes, listen for the same duration of time. Even that was powerful. So I choose controls that are very powerful, and then you in a stressed caregiver. And but what happens over time, resilience improved in parallel and meditation and relaxation. But then when it got to cognitive, it became divergent. And when you see this divergence, this is a very different effect of the intervention. Meditation improved and relaxation got worse over the course of 8 weeks. And this is in non-demented, they're normal adults. Same happened in telomerase activity. It increased with meditation and decreased with relaxation. And when I worked with the Nobel Prize laureate on this study, who got her Nobel Prize for her work, Elizabeth Blackburn. So she didn't know she never did a study in humans. This was the first in-human study. She only did experiments with mice at that time. After this study, everybody started integrating in the mind-body world, integrating telomerase or telomere length activity to know what happens to the aging process or cellular aging process. And the effects are pretty powerful. And this is 12 minutes a day, 8 week only. It's a small, short, everything. in very stressed people. This is a gene expression study. Promoter-based bioinformatic analysis showed that 65 genes changed, were affected by it. And about 43 in NF-kappa B pathway, which is inflammatory, pro-inflammatory pathway, so that was suppressed. So inflammation, the genes that control inflammation in the body were suppressed. And then interferon response factor, it's an antiviral activity, which is a good protective activity, was enhanced as a result of it. 19 genes. And this is what happened in the brain. fMRI in meditators showed higher activity in the functional network, including anterior cingulate frontal orbital cortex and the insula. And the pink dots show the difference between the groups. That's a self-referential network that allows you to understand what's happening. You pay attention to what's going on with my body, in my body. It's a self-awareness. So neural mechanisms, meditation strongly activated bilateral temporal pole known to be involved in empathy, and the difference, as I said, was in anterior cingulate frontal orbital cortex and insula. And mostly meditation was not equal rest, because prior to that, literature suggested that all of these practices have the same effect. Although fMRI wasn't available, we couldn't explore it quite, but the belief was, the lore was, from the 1970s, that meditation is rest. So our study was one of the first, actually the first, that showed that it's not the same process, that meditation neuroplastic and it activates areas of the brain that are involved in executing this chanting and multitasking, as I explained. And it has brain fitness, neuroplastic effect. So then the cognitive effects were very curious to me, and because I'm in the field, I proceeded studying yoga for mild cognitive impairment. And that's an area of interest, really acute interest at this point. 15 randomized trials, 7 acute exposure studies, and with moderate effect sizes. Limitations of the field prior to the studies were sample size. Again, they were not funded well, but now it's much improved. So we recruited people of 55 plus with subjective memory complaints, and some had diagnosed MCI, mild cognitive impairment, which is considered to be a precursor of Alzheimer's disease or other dementia. We measured different domains of cognition, mood, and other resilience. I always measure resilience just to understand what's happening here. And apathy. And 12 weeks and 24-week follow-up. So the intervention was for 12 weeks, and then we looked also at 24 weeks just to understand what happened here. Kundalini yoga, 1 class a week, 60 minutes per week, 8 to 10 per group. It has tuning in, warm-up, breath techniques, kirtan kriya, meditation, and rest. So it goes for an hour about. And then they did again kirtan kriya homework. And the memory-enhancing training was gold standard for this population, was memory complaints and mild cognitive impairment, was developed here with training in verbal and visual association strategies and practical strategies for enhancing memory. The time duration was exactly the same, 60-minute classes per week, and daily homework for 15 minutes a day. And what happened was verbal memory improved in 12 weeks. So as long as the training continues, it improved, and then it dropped down a little bit. And then unexpectedly, yoga improved, continued to improve over time, even at 6 months. Same happened with executive function. It improved in yoga, but didn't change in memory training. Depressive symptoms improved in yoga, not in memory training. And resilience improved in yoga, not in memory training. And then we looked at the subset in using neuroimaging, 14 yoga and 11 memory enhancement training. Groups did not differ by age, sex, education, and handedness. We looked at these areas, hippocampal and dorsal anterior cingulate, all important for mood and cognition. And then yoga group demonstrated statistically significant improvement in depression and visual spatial memory, and we observed also changes in default mode network, which is an evolutional network in the brain. We all have it when we are at rest, closed eyes and mind wandering, like just relaxation with no focus. It activates the same circuit in the brain. Our brains look the same at rest. So it correlated, improved verbal memory performance positively correlated with increased connectivity between language processing network and left inferior frontal gyrus, and I'll show you what it looks like. So the yellow bloods on the scan are default areas of default mode network, and the red areas show where connectivity changed over time between the groups. And on the graphs here, you see in blue yoga and in red memory training. They go in the same direction, and they're showing correlation between language, verbal memory performance and areas, these red dots. So in those areas, the change in the activation in the connectivity was correlating with performance on verbal memory tests. Also what happened, memory training changed, improved, increased hippocampal volume, and yoga didn't. And that's to be expected because memory training does exactly what it's supposed to. It trains your memory, and hippocampus is a structure that is responsible for memory. And then choline increased in yoga group over time and decreased in memory. So this was the first study to examine changes in cognition with yoga in MAT and memory training in the MCI. Cognitive outcomes, comparable changes for yoga and MAT, and yoga was superior to MAT in improving executive functioning and cognition at 6 months, and mood and resilience as well. So, we became very famous. You know, we were all around the world. India and Pakistan rejoiced. And I want to thank all of my multiple sponsors, collaborators, funders. It takes a world. It's a really complex research that we're doing here, neurobiological, just cutting through stress response and aging, biology of aging. What happens with these interventions? This is the 2 books that have been published, and thank you. So any questions over there?
Hi there. I have a couple of questions. My first question is, what is your take on the use of some of the self-regulatory, self-regulation tools, such as, for example, HeartMath, for example, they have a mechanism they call resilience building, using basically like heart-focused breath and some of these techniques. And they use a metric called coherence.
Yeah.
So has this been some of the...
They sponsored some of the studies, you know, so my journey is more into conscious participation in self-regulation. I am interested in this, but HeartMath is as well, you know, people who are attached to their, what is the device that measures
EM wave, they have EM wave.
No, the Fitbit. So
Fitbit.
the Fitbit people need to do HeartMath. You know, so it's very rational. You see what you produce, you read the numbers, you understand what's happening. The right brain people should just do yoga, if you understand what I'm saying, you know. So it's perfect. It teaches you how you can, so it gives you feedback. So this is a feedback mechanism. It's perfect.
Right.
For those who need to see the numbers.
But aside from that, actually, even if you don't look at the numbers, what I feel from my own intuitive experience is that there's an automatic way to be able to leverage the heart, basically, because in your model, I don't necessarily see the heart. So where do you place the heart in all this?
The heart is a key, you know, so
right.
Heart rate variability. So the vagal response or parasympathetic response affects heart immediately. So, and that's how you know. So when you practice, the old yogis who were in the cave could regulate their breath and heart. They would inhale and not exhale for 3 days. And then they would achieve these levels of regulation. They didn't have heart math. So it's a key. It's one of the organs. I mean, you can't separate. It's a holistic approach. Your entire body reacts to whatever you do.
Right.
You know, your consciousness tells it, or your brain tells it what to do, and then the entire body responds. Heart is a key organ, and also it's the easiest to measure. You feel the heartbeat. You put the fingers. You feel it. Your Fitbit tells you. Your heart math tells you. You know, so that's the easiest to measure. You know, you don't know what pancreas is doing.
So, but from a research perspective, is it now more and more validated that you have a lot more signals that come from the heart to the brain than the other way around? For example, I know that if I want to deliberately, for example, shift my attention, it's very easy for me to do it. As soon as I bring myself into my heart, it changes everything going in my brain. So really,
they are connected. If you take, so it's easier to control your breath than your heartbeat. So if you just slow your breath, if you put, and we're now actually working on a mouse model of meditation, by slowing your breath and the mice breath and people's breath, you change your heartbeat. You start with the breath. And that's why yogic practices don't have practices for your heart. They do, I mean, they have kriyas, but heart is affected by your breath. And the coherence happens between your breath and your heart. The swimmers and the runners achieve that zone where there's a coherence between heartbeat and the breath. But you start with the breath because it's easier to control. Is it all? Yes. Yeah, okay. Yes? Thank you.
So I was just wondering, are there any studies that show at what point you should implement these extra interventions? Like, should we be introducing this at age 30?
In utero.
Oh, in utero?
There are actually studies of pregnant women meditating, and they're doing ultrasound on the babies, and the babies get into meditative state along with the moms. And so I learned about it during my yoga training. And because they do an interesting thing, they start training people before they conceive. They do parents training, so couples come in and they go through training on changing their own consciousness, and intending for the soul to join them long before they get pregnant. And that's a yoga for conceiving a high consciousness child, for those who are interested, of course. And I don't know if they include eye color in there, but the intention is to have high vibration child. And then they take you, there is pregnancy yoga. So once you get pregnant, they take you through the pregnancy, and that was like a revelation. I was at the Golden Bridge Yoga for my teacher training, and all these actresses from Hollywood who are recognizable and pregnant would come in, and they dance and they breathe, and we would watch the session, the class for pregnant moms, the women who were pregnant. Then they had a yoga for delivery, and they had doulas who are yoga trained, work with the couples, prepare for yoga of birth, go through the birth. Then they have Mommy and Me yoga, where women who were just pregnant, now have children, come in for classes with children, regardless of age. There are like newborns coming. And the children are just amazing to watch, because part of this tradition is to have a half an hour gong meditations, very loud. Many people can't tolerate it, they fall asleep. They like dead asleep, gong sounds, they fall asleep. Children are like the happiest people, the newborns. And then they have 2 to 5 yoga training for children, 2 to 5 class, and then 5 to 15. So that's how you prevent illnesses, you know. And so they also have a movement. They train teachers. One of the, they call it SEVA, service. They go to inner city schools, and they also go to prisons. That's a big movement for yoga teachers. And to change the vibration, change the consciousness, improve quality of life for those populations. And inner city children, they focus on children. You start preventing diseases in childhood, or even earlier. There's also quite a bit of research on trauma, so inheritance. It is your grandmother's heritage that you inherit, because your mother's ovaries are formed in grandmother's womb. And mitochondrial transmission happens in this context. So, and that's why this transgenerational trauma that has been studied quite a bit in Holocaust survivors, where grandchildren and great-grandchildren have some features of grandparents and great-grandparents. And that's because this transmission of trauma happens through generations. So prevention has to start way back. It would be ideal if your grandmother started meditating. Okay. Any more? Just one last question. We need to stick.
First of all, I want to thank you for this amazing research that you're doing. I was at the conference last year, and your Kirtan Kriya presentation really struck a chord with me. It's so important for us that are coming from the humanities and the arts, and that believe or know intuitively the power of the yogic sciences, to have this grounding in our modern empirical science. And I guess I'm curious, you know, I know you come from the Kundalini tradition as taught by Yogi Bhajan, but as there's such a wealth of yogic lineages and traditions, from a sort of therapeutic perspective, how do we kind of separate the signal from the noise in terms of finding approaches that work for a widest group of people?
Yeah, this is a very, I get this question all the time, of course, and especially for those, so the yoga world, especially in Los Angeles, is very competitive. My yoga is better than yours, okay? So, and recently it's been polluted by pot. There's pot yoga, there's beer yoga, there's naked yoga, there's goat yoga, aerial yoga, and spinning yoga. And how do you discern? Well, first of all, none of those are yogas, including hot yoga, you know, by intention. And I can tell that your mind is in your heart. So, the science only now approach. So up until now, we were trying to understand what a yoga does, you know, some type of yoga does. At this time, there's some interest on the part of the National Center of Complementary and Integrative Health, but also the research community that is not big, to study different types and compare one to another. From my observation of what happens in the research, I can tell you that it matters what you do in meditation, you know, brain-wise. So we're limited by our methods, you know, what we can measure. And, you know, as far as stress response, across yogas, you would measure the same thing. And therefore, it's like having light in one place and looking for your keys only here, you know, but there's this vast universe of what's possible. So we're not measuring out there, we're only measuring here what we can. And we're limited by it. So if you measure cortisol from one study to another, that's all you know. When it comes to the brain, you can actually see what it does because it activates different areas of the brain. And it has to do not just with an overall effect of meditation and or whatever practices you do, but also elements of it. You know, if if you squeeze, so in my stroke patients who are paralyzed, the first thing that I would do, I would ask them to start squeezing the tennis ball. And that's where rehabilitation starts. Because once you do that, it activates motor strip, and from there it spreads. So that's where you start. And that's how you know, we pretty much know what areas are activated with what action. And so you could watch what happens. Another tool that is very helpful, and I don't know whether it's different from one yoga to another, is gene expression, because I just completed a study of memantine augmentation of S-citalopram versus placebo and S-citalopram. And the genetic study, gene expression, is completely, vastly different for the two groups. And it tells the study of what this thing is doing to your genetic makeup and what it translates into other physiological reactions and protein synthesis. So, and that's what needs to be done to understand what a particular type does to you. Okay, any other questions? We need to move on.